Come in. Please sit down. Hello, Mr. Alex.
Yeah.
You have scheduled an appointment tomorrow for EEG, right?
Yes.
Okay. Do you have
Could you tell me why I need this EEG and how this procedure will go? Also, can you tell me the risk of this procedure?
so, Mr. Alex, you have a history of seizures, right? So, this EEG we are doing so that we can check your brain electrical activity. And for this procedure, there aren't risks. Since you have seizures, there is slight risk that when we do the test, at some parts we will use flashlights, or we might ask you to deep breathly in order to check brain activity during these different activities other than at rest. So during these times, it is possible for you to get a seizure, but the possibility is very, very low. And in case it happens, there will be a medical team on hand and they will attend to you if you need any medical attention. So don't worry, you are in safe hands and there are no other risks, no electric shock, no nothing. And the procedure is quite simple actually. So you will lie down on the exam table, a bed, and I will put around 20 small sensors on your scalp. First, I will measure your scalp and check your head circumference, because for different people it's different. So the positioning of the sensors will be different. So these sensors, they are called electrodes. They pick up electrical activity from cells inside your brain. These cells inside your brain are called neurons, and they send them to the machine that the sensors are connected to, and they will show as lines recorded on paper, and it will be also displayed on my computer screen, from which we will know your brain electrical activity. So when the recording begins, I will tell you to remain like I'm beginning, and to sit still. So at first, you can sit and relax with your eyes open, and then I will give you instructions to carry on with the examination. Then you can close your eyes when I tell you to. Then I will ask you along. You'll be resting, and then I might ask you to take deep breaths. This is called hyperventilation. And also, we might show you a flashlight, as I said before. These all things are to check your brain's electrical activity during different times, during different activities. During this, the machine will record the activity of the brain, and we will get the results. So as I told you, it's very rare to get a seizure during test, and in case that happens, our medical team will be on hand, and I assure you that it is safe. Don't worry about it. And we will be doing sleep EEG also to check your brain activity during sleep. So there are some things that you need to prepare before an EEG.
You have explained the procedure very well to me, but you did mention some preparations that I have to do. Can you tell me more about that?
Yes, so if you take any medications, you can take those medications, but for the seizure medications, you will have to lower the dose. I will give you the instructions for it with the papers. And please wash your hair before the appointment, because having any wax or anything in your hair, it will be difficult for the sensors to stick. And please make sure that you have a good meal the night before. which is tonight, as you are having test tomorrow, because low blood sugar can give abnormal results. It can interfere with the testing. So please make sure that you have good meal, and please use the bathroom before the exam, because once it starts, it's not we can't go out. It's so it can last around 1 hour or 1.5 hours, the test. And so since we are doing sleep EEG also, please make sure that you sleep a little less the night before. Sleep late and wake up early. Then it will be easier for you to sleep or take a nap during the exam. You will fall sleep easily, and that's it. And yes, I mentioned about medications, right? So please bring a list of all the medications you are eating, any prescriptions, so that we can know if it can affect the procedure or not. And I will be monitoring you throughout the procedure. I will be giving you instructions. You'll just have to follow my instructions. Is that okay?
Yes.
Do you have any other questions?
No, thank you, doctor.
Okay, then see you tomorrow. Thank you. Mr. Alex, welcome to your appointment. So, do you remember what the instructions I gave you yesterday?
Yes.
Did you follow them?
Yes.
Okay. So, did the nurse give you the consent form?
Yeah.
So, can I start?
Of course.
First, I will measure your scalp as I told you, and I will mark points so that we can put the sensors. And after that, I will be applying an abrasive. It won't sting, just so that the sensors stick. And I will tell you as I am going, and after the procedure, I will be observing you from there. You can see. You just relax and follow my instructions. Okay?
Okay.
Okay. Please lay down comfortably. Okay. Now I will measure your scalp. Okay, Mr. Alex? Now marking some points. Now I will apply the abrasive gel, okay? So there will be around 20 or 25 sensors, about 20 sensors, okay? Now please relax, I'll be there and I will be giving you instructions. So first please keep your eyes open and relax. When I tell you to close your eyes, please close your eyes. Can you please close your eyes, Mr. Alex? Relax. Can you take deep breaths, please? Once more. Okay. Now I'll be flashing a flashlight. Okay. Please tell me if you have any discomfort. If something is happening, please let us know. Okay. Okay, now we will carry on with the sleep EEG. I need you to rest, okay, and take a nap. Okay, Mr. Alex. That's all. I'll be removing the sensors now and I'll be cleaning it with warm water so that there's no stickiness. We will inform you when the results are ready. We will call you and you can come to receive the results. Thank you. Please come in. Sit down. Mr. Raju, yes?
Yes.
You're 52 years old?
Yeah.
Okay. So you're here for an appointment for ECG, yes? Okay. So this ECG, do you know why we do it?
No.
Okay, so ECG is a very simple procedure. It's absolutely painless and it is very safe procedure. So we use this to detect different problems with the heart. For example, if there is an irregular rhythm or if there is any defect in the heart, so we will know by doing this. And so it will monitor the electrical signals which is sent to the heart. Okay. Uh, and it's a very safe procedure. It's a non-invasive procedure. Is there anything else you would like to know about the procedure?
Could you tell me how it works and what do I need to do?
So, for before the procedure, please avoid taking anything cold, like any cold fluids, because cold water or cold drinks might give misleading readings in the ECG graph and the electrical patterns recorded. And avoid doing strenuous physical activities, because it might produce false positive results. And avoid applying any oil or creams or lotions before this procedure, as we will be putting electrodes or sensors on your skin. So putting oil or something would end up in the sensors not sticking to your skin. And for the procedure, you will lie down, and as I said before, we will attach electrodes or test sensors onto your skin. Before that, we will apply some gel, so you might feel a little bit of cooling effect. It's normal, it's okay. There will be around 12 electrodes on your chest, two arms, upper limbs and lower limbs, okay? And that's it. You just lay down. It will take a few minutes. It won't take long. And you can breathe normally during the test. Uh, there's no other instructions other than that. You can just follow as I tell you. And as I go on with the procedure, I'll be telling you what I'm doing. Okay? Okay. So see you tomorrow for the appointment. The patient is laid down, and before placing the electrodes, the skin is wiped by alcohol swabs and a gel may be applied so that the sensors or electrodes will stick to the skin easily. The chest lead placements are as following. V1 is applied on fourth intercostal space right of the sternum. V2 is applied on the fourth intercostal space left of the sternum. V4 is applied on the fifth intercostal space at mid-clavicular line. And V3 is applied directly between the leads V2 and V4. V5 is applied at the same level as V4 at the left anterior axillary line. And V6 is also applied at the same level as V4 at the mid-axillary line. which is directly under the midpoint of the armpit. The limb leads are applied on upper right arm, upper left arm, lower right leg, and lower left leg. The ECG machine will record the electrical activity of the heart. The ECG looks as the following.